In the pre-hospital world, we have a phrase, the golden hour, whereby we try and get a patient who has suffered a serious illness or injury to hospital within that hour to have definitive treatment. We also have a phrase called the platinum 10 minutes. The first 10 minutes of somebody who's having a life-threatening illness or injury is where all the real life-saving stuff happens. And that's not often the ambulance service that do that. It's you watching this video. During these episodes, we're going to be looking at some of these life-saving techniques and how you can use these to help save someone's life. You're watching the 10-Minute Medic. On this episode, we're going to be discussing the use of a defibrillator on a casualty that is not breathing. So today's episode is sponsored by Dutchy Defibrillators, and we're really lucky today to have Alan from Dutchy Defibrillators with us. Hi, Alan.
Hi, Mark.
So, Alan, what is a defibrillator?
Oh, thanks for asking, Mark. So, this is a defibrillator, and you might have also heard them termed as an AED, and that's actually just the same thing. This is a defibrillator, which is a medical device that you will possibly see out and about, which will be used on a casualty who is in cardiac arrest. So,
what does it consist of?
Okay, so the defibrillator consists of a couple of parts. Generally in the back part, which I'll show you in a second, is the prep kit. They also have an internal battery which powers the device, and they have a set of pads which we need to place onto our casualty. In this instance, those are found on that green tab there.
I know that my heart is about the size of my fist, lays in the centre of my chest and slightly to the left. So what is a defibrillator going to do?
So the defibrillator pads are going to be analysing across your heart to see if it is in fibrillation, which is the electrical currents that are not working correctly within that heart. And it's going to try and provide an electrical current to that to bring it back into its normal rhythm, hence the name defibrillator. You'll find a defib in lots of different places, such as a public access cabinet like these ones, which you can find at pubs, village halls, community centres. There are also some in supermarkets and shops. There are loads around. You probably have seen them either in a green or yellow cabinet if they're public access.
So I notice it's got a lock on the front. How do I manage to get into that lock? Is there a code?
For the lockable versions, there is a code, and the ambulance service will be able to provide that code for you if their defib is listed on the circuit, which is a national database for defibrillators. Some will also be unlocked, so you can just take the defib straight away.
So I make a 999 call to the operator, ask for the ambulance service, tell them that I've got a casualty that isn't breathing, and they will tell me where my nearest AED is, and they will give me the code to the lock.
Yeah, so they'll tell you where it is, and if you need a code, they'll give you that code so someone can go and access it.
We've got a casualty that's not breathing. How do I tell that they're not breathing?
So we can do the three-step approach of look, listen, and feel.
So I'm looking at the chest rising and falling.
Correct.
I'm feeling the breath on my face,
yep,
and I'm listening for the casualty breathing.
Yeah, I should really point out here, this has to be known as normal breathing.
And how long do I do this for?
10 seconds.
So after 10 seconds and my casualty isn't breathing, what happens next?
So the operator will tell you that you now need to be doing chest compressions.
Okay, so what does that entail? What do I need to do for chest compressions?
So you need to be interlocking your fingers if possible.
Okay.
And we're going to use the heel of one hand.
Yep.
Over the centre of the chest.
About here?
Yep.
Okay.
Yep, and we're going to push down a third of the depth of the body, but we're going to make sure our shoulders are up and over the body to let gravity help us when we're doing our chest compressions.
So that's really difficult on a table, and I'm guessing if our casualty was on a sofa or in a bed, we'd need to get them, if we could, onto the floor, onto a firm surface.
Yeah, onto a firm surface, which is mainly onto the floor.
Okay, so we'll demonstrate that later on. So where do we put the pads once we've got the defibrillator?
So let's open it up and have a look. So obviously normally you would have turned this on and this will talk for you, but rather than have that talk for a minute, we'll just show you. So you're going to pull the green tab. Now this is one make. There are lots of different makes and models of defibrillators, so there could be pads in different places, but for this model they're in the green tab at the bottom, and which when we pull that, it'll open up into this little package, and we're going to tear the package open. And inside the package, these are our pads. You'll see on the pads that there is a drawing, so it shows you where to put them if you can't quite remember.
Okay, yeah, I see that.
And we're going to peel the pads from the liner. So there's our first pad, and we're going to just place that just there.
Okay, so the
making
top
sure,
right-hand side of the chest.
Yeah, making sure we get a good seal, and that's as shown in that diagram.
Yeah, I can see that. So where does the second pad go?
Okay, so you're going to unpeel that from the liner, and that's going to come around, again as shown, just on the side here. And again, push down to get a really good seal.
Okay, is it really important that I get the pads in the correct position?
Yes, it is, Mark.
Okay, and why is that? Why is it important that the one pad is on the right upper side of the chest and the second pad is on the left lower part of the chest on the side there?
That's a great question, Mark. So the pads will analyse across the heart, and if it needs to provide a shock, that will come right across the centre of one pad to the centre of the other, which hits the heart, as you said, in the centre, slightly left of the chest.
Yeah, because my heart is in that side of my chest, and I guess that would pass right through the centre of the heart.
Yeah, correct.
Okay, I get that. So Alan, what happens if this chap has got a hairy chest? Are the pads going to stick to the hairy chest?
So they're more likely to stick to the hair. They might not get that quite really good contact on the skin. So in your prep kit is a razor for that reason.
What do I shave? Do I shave just this part of the chest?
Yeah, shave just the area where the pads are going. No need to shave anywhere else.
Okay, and if there are any jewellery or any patches, say if it was a medication patch, do I take those off or do I leave them on?
So if there's any jewellery, you can leave it as long as it's not going to be in the way of where your pads are going to go. So try and tuck it in. If you're not 100% sure, then remove them. Medication patches must also be removed. And
I know that some casualties have pacemakers, which is normally on the left, I know. So do we leave those alone, or what do we do? Is that a problem?
No, so we want to leave that pacemaker alone. It's not going to be a problem for us. We're using a defib.
And if my casualty is wet or damp, do I make sure that they're dry before I stick the pads on?
Again, so in the prep kit there will be some either a cloth or some tissue, and you can just dry the area where the pads are going. That's the only areas that we're worried about. We need these pads to be onto bare skin with no items of clothing in the way. If the casualty is wearing a bra, that must be removed as well. It's also worth mentioning these are one use only, so it's really important that once they're applied to the casualty's body, that's where they remain.
So once the pads are in place and the defib's on, it's going to analyse the rhythm of the heart, and then it may want to deliver a shock?
Yeah, correct. So once the pads are in place, it will then tell you to stop CPR, to move away and let it analyse. And then if it wants to deliver a shock, then it will tell you to deliver a shock. But it's important that everyone is out of the way.
So nobody at this point touches the casualty?
Correct.
And why is that?
We don't want any interference with the analysing from you doing compressions, because you may give it a false reading.
Okay, and I guess it might pick up my heart rate.
Every possibility.
Okay, so it's really important to stand away from the casualty and let the defib do its work and analyse that rhythm. I noticed that there are other different types of defib available, and I know we've been using this one today, but it can be quite confusing if there's different types.
No, not at all, Mark. So they may all be different makes and models, but they all do the same job.
So they've all got two pads in them, and they all shock in almost the same way as this one?
Exactly, they're just a different make and model.
I can see a casualty on the floor. I'm firstly going to make sure that the scene is safe. Hello mate, can you hear me? Can you open your eyes? I've got no response to that. I'm going to check his airway, make sure there's nothing in his airway. His airway is clear. Give him an airway by means of a head tilt. I'm now going to check for breathing for up to 10 seconds. I'm looking, listening and feeling for breath. 10 seconds, this patient isn't breathing. Alan, can you give me a hand, please? I've got a casualty that's not breathing. Can you phone 999 and get me an ambulance?
Ambulance service, please. No, our patient is not conscious and not breathing. We've come across an unconscious casualty. My colleague Mark is already doing chest compressions. No, we don't have a defib on hand. There is a public access one nearby. Yep, I know where that is. Okay, I can go and get that. I shall leave my phone with my colleague Mark. Mark, I'm just going to go and get you a defib, mate.
Okay. So I've decided just to do compressions. I don't want to do mouth to mouth, but I want to concentrate on just doing the compressions. I'm compressing the chest around 1/3 of the depth of the chest. On an adult, it's around 5 to 6 centimetres. My hands are in the middle of the chest, and I'm compressing at the rate of 100 to 120 compressions a minute.
Right, Mark, the defib is here. I'm going to turn the defib on.
I'm going to carry on compressions until Alan's ready.
Right,
I'm going to stop
just
quickly while we get the chest clear.
Chest clear.
Okay, I'm going to carry on compressions.
Pull green tab to remove pads.
Okay, so I've got the pads coming out.
Peel pads from liner.
Okay.
Apply pads to patient's
I'm just going to put the first pad on, Mark, next to you, okay?
Press pads firmly to patient's bare skin. Pull green tab to
Just come
remove
across it.
pads. Peel pads from liner. Assessing heart rhythm.
Okay, so I'm not going to touch the patient now. Standing well clear.
Analyzing. Do not touch the patient. Stand clear of patient. Shock advised.
Okay, so make sure nobody's standing clear.
Patient.
Nobody is touching the patient.
Press the orange shock
Okay to
button
deliver, Mark?
now.
Yep, shock.
Shock delivered. Begin CPR.
Okay, I'm now going to get back on the
It is
chest
safe to touch the patient.
and do
Place overlapping
compressions.
hands in middle of chest. Press directly down on the chest in time with metronome. Remain calm. Good compressions.
Now compressions can be really tiring, and it's important to change the person who's doing compressions quite regularly. So Alan, are you ready to take over from compressions?
Yes, mate.
Are you ready?
Yep.
Good
Okay, and you're on. So we're going to carry on doing compressions for 2 minutes, and then the defibrillator is going to analyse the rhythm again. In this episode, hopefully we've given you a little bit of confidence on how to use a defib correctly on a casualty that isn't breathing. Hopefully you've liked this video. Hopefully it's given you some confidence in able to save a life. If you did enjoy the video, press like and subscribe to the channel. See you next time.